In this presentation, we will discuss communication strategies that you can use in order to improve your interactions with your loved one with dementia. The objectives of this presentation will be to discuss some of the common causes of miscommunication in dementia, to review adaptations that can improve communication, and to review effective methods of communication. What are some of the causes of miscommunication? First is forgetting or misunderstanding words. Your doctor may call this an aphasia. Hearing loss can also often cause miscommunication. Forgetfulness and being confused about person, place, situation, or time are factors that can also cause a miscommunication. Aphasia. Aphasia is an inability to understand or express speech. There are two categories of aphasia. First is a receptive aphasia, which is difficulty understanding speech. Next is a conductive aphasia, which is difficulty expressing speech. Aphasias can occur due to damage in areas of the brain responsible for speech production and understanding. Due to an aphasia, you may notice that your loved one will often become frustrated when they cannot find the words they want to say. You may notice that your loved one has a hard time following even a simple conversation or simple instructions. Below you will see links to videos on receptive and conductive aphasia. Please return to our website at the conclusion of this presentation and go to the supplemental videos section to watch these videos on receptive and conductive aphasia. Ways to improve communication in an individual with aphasia. Supply words instead of having your loved one struggle to find a word. Ask them to point to or describe what they are trying to say. Try to ask yes or no questions. Avoid arguing. Speak calmly and slowly so that they can understand and respond. Break down requests to individual components that they can perform one step at a time. Try to offer choices instead of demanding your loved one to do something. For example, don't say, "Take your medicines now, Dad." Instead ask, "Dad, would you like to take your medicines before dinner or after dinner?" Hearing loss. Hearing loss affects 33% of adults over age 60. This increases to more than 80% in adults older than 85. Hearing loss can be caused by damage to the hearing nerve or sometimes blockage in the ear canal. Hearing loss can affect a person's understanding of speech. Hearing loss can cause frustration for a caregiver, as the individual with hearing loss may have a hard time following instructions. It can also frustrate the individual with hearing loss, as they will have difficulty following what is going on. Ways to improve communication in hearing loss. Ensure that your loved one has their ears examined and cleaned when they see their physician. If you are noticing worsening hearing loss, having the ears examined for a potential blockage in the ear canal is important. Ensure hearing aids are available. Speak slowly. Rate of speech is more important than volume. Communication boards may help. There are many free communication boards you can print off online. This is an example of a communication board that can be used as an aid to facilitate communication with your loved one with dementia. Confusion and forgetfulness. Due to the degree of memory loss, your loved one may forget where they are or who their loved ones are. Confusion can spark arguments, as you may not be able to rationalize their thoughts and they may not understand what you are saying. Your loved one may forget that they had asked or told you something before, so it can become frustrating when they seem to repeat the same question or request multiple times. Tips to improve communication in a patient who is confused and forgetful. Agree, never argue. Arguing will just make you upset, and your loved one will not understand why. Try to change the topic or distract them instead. Repeat what was said. Don't try to keep explaining the topic with different words. It may just cause more confusion. Be patient. Remember that they are not intentionally forgetting what was said. In summary, there are multiple causes of communication failure in dementia, including aphasia, language loss, hearing loss, confusion, and forgetfulness. There are adaptations that can help improve communication. The most important thing to remember is to speak slowly, not necessarily loudly. Speak in a calm voice, as tone matters more than the meaning, and try to use as many communication aids as possible, such as hand gestures or communication boards. Remember to be patient. Your loved one is trying to understand you and is likely getting upset because they are frustrated that they cannot. If they do not understand the first time, repeat exactly what was said, but think of changing the tone, speed of speech, or using a communication aid to assist. This concludes our presentation on communication in dementia.